reminder, anyone who's in the back of the room, if you'd like to take this opportunity to move up, there's plenty of seats up front. We don't want you to miss any of the visuals of our next presenter. So feel free while I'm doing the introduction to change seats if you're so inclined. I have two things to do this morning. The first is to officially welcome you to Vermont. Those of you who live here, welcome home. Those of you who are visiting from the other New England states, welcome, and we're hoping that you're having a great time at the summer school. Weather's not super, but it looks like it'll hold pretty well while you're here. So, and maybe that's better for being inside for the classes. So, welcome again, and we're really pleased to be able to host you. And I understand St. Mike's has been great to work with, so I'm glad it's all working out so well. With that, it's my honor to introduce our speaker this morning, and I'm not going to read any official bio because I don't really like to read all those. Tom's got plenty of initials and history and so forth, and I think you can read that for yourself. But more importantly, to me, Tom is truly one of the special leaders in our field. I first had the opportunity to know of his work in reading his research, and much of that is foundational to the work we do in our field, the project match studies, development of the ASI. These are all tools that have become the foundation of what we do. And it's a rare opportunity to hear from someone personally who has been so influential on how we do business. But what I appreciate about Tom is he doesn't sit back and say, okay, we figured this out, this is it, let's just do what we do. He's always questioning, how can we do it better? How can we continue to make these services more appropriate, more relevant, more usable for the people who suffer from addiction? And that, to me, is his real contribution. He doesn't let us sit back and take anything for granted. And this whole idea of moving toward chronic disease approach, addiction is a lifelong struggle. Prevention is something that has to be done in a holistic way. Tom has really been one of the drivers toward helping us see that we have to make some fundamental changes, and he's going to share with us on that today. So right now, he's the Deputy Director of the Office of National Drug Control Policy, and we are really, really pleased to have him be with us here and be able to share with you, most of you on the front line, and really hear the thinking about where we're headed in the future. So my pleasure to welcome Tom.
Is this on now? People here? Okay, good. So nobody had the opportunity to move forward. I can see if I had seats outside the building, I guess I could have probably sold them. So it is my pleasure to be here. As Barb said, I've known her for a very long time and admired the work that she's done in various places she's been. New England has a number of very fine SSAs. Well, today I want to, I have to absolutely acknowledge, I guess you guys may know, that St. Michael's is the alma mater of the state senator, Senator Leahy here, who has been a very, very fine champion of our work. We've got one of the staff here today. Maggie is here. Maybe you want to raise your hand? Yeah. So actually, you guys are going to sit way in the back. I'm going to get casual myself. I want to tell you basically what we're doing with your money. I work at the Office of National Drug Control Policy. It's a White House office. And the office does just three things, okay? The first is we craft with the President's drug control strategy, and I'm going to show that to you today. That's fine. That's a paper, and you can read it. By the way, it is available. It's on White House, www.whitehouse House Drug Policy, one word, whitehousedrugpolicy.gov, and you can read the whole 300 pages. Okay, so that's a piece of paper. The second thing we do has much more influence, and that is we work with 35 federal agencies to see that their budgets comport with that drug strategy. In other words, we ask them to make their budgets reflect what you're about to see. And after that process is over, then we work with those agencies to try to roll out the strategy. So I want to share with you what we've done and why we've done it, okay? And I really want you to pay attention to this diagram, because I guarantee you, some of your buddies are going to walk out and at the end of the thing, they're going to have their hands on their hips and say, this guy's ruining the view. He's taking all our resources and giving it to those doctors. Please watch this one. You can fall asleep right after this. This is very important, the rationale of what we're trying to do, okay? It's a very old diagram. It was first done in 1990 the Institute of Medicine looked at broadening invasive outbreak. And it's a portrayal of substance use problems in the population at large. And notice the phrase I'm using, substance use problems, not just addiction. Addiction is one of the end point of a continuum of substance use problems. If you look at the bottom of this pyramid down here, that's the largest proportion of the pyramid, and that corresponds to the majority of the population. And in fact, most of your population in this country either does not use substances at all, or uses very, very little. What's the policy implication, you say? Well, let's keep it that way. That's why we make prevention, right? Making sure that people who haven't started to use or are not using very much at all don't. Now, you see that sort of wavy line there that breaks it. That's the point where frequency, duration, intensity of use has reached problematic levels. It is not a diagnosis. You're not an addict at that point. You're drinking too much. You're using, you're drinking 2 6-packs of beer and then getting in your car and driving. You're smoking marijuana and you're going to work and you're screwing up at work. You're using cocaine and your wife's upset about it, things like that. And this is what is called harmful use or unhealthy use or problematic use. It is not, repeat, not a diagnosis, but it is a problem. And as you can see, we got a lot of people with those problems, 68 million of them, okay? Point, we've never had interventions, we've never had services for people that aren't at the most severe end of the continuum, and we need them. These are your kids. These are the people that are your neighbors, okay? Now, you see the bright line, the bright yellow line there? That signifies when the frequency, duration, intensity of your substance use. And when I say substance, I mean everything except cigarettes. Of course, cigarettes is an addiction as well. But here, the numbers we're talking about include alcohol, opiates, cocaine, prescription opiates, everything other than cigarettes. Well, when your frequency, duration, intensity of use reaches that yellow line, you have a diagnosis of abuse or dependence, the most serious of the substance use disorders. And there are about 23 to 25 million people whose use is diagnostically a problem. That's a lot. Compared to what? Well, you